And now I want you to hear from someone who, with his amazing team, thank you to everyone at Test and Trace. You've done an absolutely outstanding job. And remember, everyone, this had to be created from scratch. What an amazing effort, but they've had a dynamic leader, always energetic. And I know he is pumped up at the notion of taking what we learned and making it something permanent in this city. My great pleasure to introduce the director of the Test and Trace Corps, Dr. Ted Long.
Thank you, sir. Since June of 2020, our contact tracers have been fighting to keep our city safe against COVID. Our contact tracers are all New Yorkers that saw what COVID did to their communities. They heard the call to help and they responded. Our contact tracers have been able to reach nearly 90% of all new COVID cases across New York City since they started in June of 2020. Furthermore, they've been able to identify more than 1 million close contacts or New Yorkers with a known direct exposure to somebody with COVID. And they've been able to engage 72% of those New Yorkers that have been exposed. Now, identifying 1 million close contacts is 1 million opportunities that they've created and used to connect New Yorkers to critical resources, like our free hotel program, where you can come to definitively isolate or quarantine to keep your family or your community safe. Like our direct cash assistance program, which is unique to New York City to support families that don't qualify for paid sick leave, but the right thing to do is to stay home to keep their communities safe. Our tracers have also been able to connect New Yorkers to life-saving therapies like monoclonal antibodies and to at-home testing and at-home vaccinations. Our tracers have succeeded in keeping our cities safe because they understand our communities, because they're from our communities. I'm excited to be here today to help to launch the new Public Health Corps, which will be an incredible way that we can leverage all of the skills and experiences that our contact tracers have built over the last year to become effective community health workers. Now, I'm a primary care doctor myself. I've seen my patients in the Bronx throughout COVID. What I want is to be able to care for my patients beyond the four walls of my office. With the new Public Health Corps, I will have community health workers on my primary care team by my side that can go to my patients' homes to help them to get food, to help them to get their medications, to help them navigate our healthcare system, and to help them to live a healthier life. Launching the Public Health Corps today truly makes New York City the public health capital in the country, if not the world. The Public Health Corps will build on everything that we've created through Test and Trace, with our community health workers being a backbone of this new program that will make New York City stronger and healthier than ever before. Thank you, sir.